So rosacea is a common chronic inflammatory condition that affects the central face, and it's most commonly seen in individuals with lightly pigmented skin, and it commonly affects women starting in their early 30s. There are several different forms of rosacea. The most common is erythrotelangiectatic, and with that, patients present with kind of increased redness or flushing of their cheeks, and they can also get some small fixed blood vessels on their skin called telangiectasia. Patients can also get a more acneiform type of rosacea, which has the underlying redness and flushing, but they also have acne-like inflammatory bumps. And to distinguish this from acne, the patients typically don't have the comedones, which are the whiteheads and blackheads that you typically see with acne. Thirdly, patients can have a very severe form of rosacea called rosacea fulminans, and this presents with intensely inflammatory pustules and draining sinuses, and this can sometimes have a fairly sudden onset. And lastly, patients can have ocular rosacea, which presents with redness and often like a gritty sensation in their eyes. Rosacea is typically a clinical diagnosis that your dermatologist can make from the history you provide as well as your clinical appearance. For more of the inflammatory types of rosacea, we may also do an in-office skin scraping or bacterial swab. This is done because inflammatory rosacea is thought to be a hypersensitivity or overgrowth of normal skin flora, such as Demodex mites or certain species of skin bacteria, and we can target your treatment based on what grows in your culture or the scraping. And finally, there's some other dermatological conditions that can resemble rosacea, so sometimes we'll do a skin biopsy if needed to evaluate for them. But I would say this step is typically not done and reserved only for patients not responding to treatment or with features suggestive of one of the other conditions. Thankfully, we have several different treatments now available for rosacea, and we target them to the type of rosacea that you have. However, for all patients with rosacea, we know that UV exposure is a known trigger, so we recommend daily application with a mineral-based sunscreen. Also, for all patients with rosacea, we know that their skin is very sensitive and easily reactive, so we counsel them on gentle skincare products without unnecessary chemicals or fragrance. And then for the flushing type of rosacea, the erythrotelangiectatic type, we have certain creams that can help constrict the blood vessels to help minimize the flushing. For the more inflammatory types of rosacea, we have oral as well as topical antibiotics, as well as topical ivermectin, which can be used for the Demodex mites. For the severe type of rosacea fulminans, we sometimes do a course of isotretinoin, which is an oral medication that we use for acne. And then for ocular rosacea, we typically coordinate care with your eye doctor and treat with oral doxycycline. But there are many more treatments for rosacea than the ones I mentioned, and we would use them in certain cases, kind of based on your type of rosacea. I would say the number one reason to see a Hopkins dermatologist for your rosacea is there's several other conditions that can mimic rosacea: lupus, dermatomyositis, acne, sebderm, just to name off a few. And a Hopkins dermatologist is knowledgeable on these mimickers and can get you to the correct diagnosis and the correct treatment plan. Secondly, our team has a lot of experience treating rosacea and can help identify the type of rosacea that you have and give you the best treatment options for your particular subtype of rosacea. And finally, if you come see us at our Sibley Memorial Hospital office, we have access to a vascular laser there, and this can help erase the appearance of some of the small fixed blood vessels that can be prominent in rosacea and can be cosmetically bothersome.